we have some very exciting news to share with you in relation to this. We're excited to have Whitney Richards on the call with us today. Whitney is he is a member of our business development team and has worked an awful lot with Kaiser Permanente in rolling out a project that involves small business we're excited to tell you about. And I'd like to also mention that we have Ryan Isaacson on the phone, he's our operations, the Vice President of Operations. We're glad to have him with us. He'll be manning the questions. You can ask questions at any time during the webinar by simply typing in the question area on your GoToWebinar control panel. There are about 600 of you on this call today, so all your phones have been muted. The only way that you can interact during the webinar will be to ask questions. We'll have time at the end to take your questions, and as always, we welcome you. And without further ado, I would like to turn the time over to the man, the myth, the legend, the controversy. You love the book, now see the movie, Dr. Stephen Aldana.
Troy, you should have never gotten out of bed this morning.
I shouldn't have, no.
But you're a trooper for joining us. Thank you very much. Good morning, everybody. Good afternoon for those of you on the East Coast. A lot happening across the United States. We've been in Detroit, we've been in Cleveland, we've been in Columbus, got home last night from large, the Ohio Business Congress, which is in essence in the state of Ohio, workers' compensation insurance is required to get from the state. There's only one vendor of workers' comp. At their huge safety congress, had 5,000 people, and they had a wellness theme for the entire conference for a safety congress. So we've got 5,000 people traditionally from safety who are now more fully engaging in the wellness discussion. And here's the reason. Ohio has a single payer for workers' comp. There's only one option in Ohio, and that's the Ohio Bureau of Workers' Compensation. Everybody pays premiums to the one large, huge state organization. They have looked upstream and said, if we're going to get serious about wellness, we have got to get employers started down the steps, because workers' comp is a wellness issue. And they know that if they can go upstream, prevent not only safety, they can prevent chronic diseases from occurring. We're going to have less workers' comp. So they're really aggressive about the prevention of injuries and disease, all under the umbrella of safety. I found it very refreshing, and not very many groups that are like this. The place is full of small businesses who are doing an awful lot of dangerous work with a lot of chemicals, who are now starting to engage in wellness discussion. So a lot of good meetings happening around the country, a lot of good conferences, more and more happening. I want to show you some results that have happened from some recent research we've done with small business and small business wellness. I want to talk about the barriers that small companies face when they're trying to do this from both a broker and from an employee wellness perspective. On the 600 people we have on the webinar today, about 65 to 70% are insurance brokers. They're here because they're engaged in these discussions more than anybody else. Then we have some wellness professionals on the call, and then we have a variety of wellness vendors here. We welcome you all, but let me show you some of the data that we've been coming up with and publishing. This is in the Journal of Occupational Environmental Medicine. It's in press. It's supposed to come out in the next 60 days. This was part of a big five-group study. This little group is the Rural Wisconsin Health Cooperative. They're kind of a small health co-op. They have 60 employees. So this is a company with 60 people who wants to do wellness, mainly because they're helping their clients do wellness also, and they want to be able to practice what they preach. So they started a very aggressive comprehensive wellness program back in 2009, and we've been following their data, and we've actually just recently published their results. So here's an example right off the bat of a small company that has had 94% participation in their behavior change programs. And let me just show you the outcomes and the results. Here's year one. Now this is baseline to 12 months. 12 months is a year. This is a change that has persisted for at least a year. Days of exercise weeks gone from 3 to about 3.5 days on average per week across the 60 people. Now, the studies we've been doing in the past like to look at short-term windows, 6 weeks 8 weeks, 12 weeks, 6 months. We get big changes right after these campaigns occur. It's the big dose response. But as we go out to year 1, year 2, year 3, we generally start to see what I call behavior change decay. Yeah, it was great, but now the world's back the way it was, and I'm going to go back to my original behaviors. That's what we have seen mostly in the literature. At 12 months, these people are way up on their exercise per week. Their minutes, this is exercise days per week. Here's fruit servings per day. So they're up almost 3/4 of a serving per day for fruit. We've got vegetable servings that are up almost a half a serving. And you're going to go, half a serving per day per person. That's nothing. To be honest with you, that's 4 or 5 times the impact we get from large community interventions. The nutrition studies that are done on large groups, they'll get 10% increase or 5% increase. This is actually really, really good. Some of the largest increases in fruit and vegetable consumption after a full year. Absenteeism days are down a little bit, down by about 1/4, which is good. They're saving money in absenteeism. They have self-reported productivity time. This is kind of a measure of presenteeism, up a little bit after year 1, so they're liking it. There's another study, and I've mentioned this one before, Lincoln Industries. We published 2 papers in 2011. They're a metal manufacturing plant. They have 300 people, and they have a full-time wellness person on site. Actually, you have 1.5 full-time wellness people on site. Just quickly, what we published on their data, this is their blood pressure, systolic, after 3 years. 3 years is pretty meaningful. If you consider that after 3 years, everybody's blood pressure goes up just by the passage of time. Their high blood pressure is down, systolic down 20 points, hypertensive, prehypertensive is down 4, normal up a little bit, but across time we would expect those to be flip-flopped. So we're getting a nice change in systolic, a nice change in diastolic blood pressure. We look at changes in body fat. We have the non-obese at baseline, what happened to them over 3 years, and the obese at baseline, what happened to them over 3 years. Well, the ones who are not obese are up about 2 to 3% body fat after 3 years, which is actually pretty normal. The obese, on the other hand, are flat or down 2%. And I'd like to tell people, and I've been telling them for a long time, here's the weight changes, by the way. Remember, the normal weight, they gain weight. It's like if you wait long enough, everybody will be obese. The normal weight people will catch up. Overweight, the same. Obese, they drop. And here's my point. I've been looking at these studies, and these are small businesses, large businesses. I'm on the COOP board, and we look at all of the best of the best. Nobody's making obesity go away. It's, for all intents and purposes, it's been undocumented. It's almost impossible. But I do say you can make it not go up. If you can keep your people from gaining weight, you have just made a big impact on your employees' population, because they're going to gain across time. You wait long enough, we're all going to be obese and overweight. Just keeping it static is actually a big, big effect. Well, that's another study. We published both of those in 2011 on Lincoln Industries. Let's talk about small businesses and where we're at. If we look at the data on small businesses, about how many there are, where they're at, how many people are engaged, where people work, the data from the census in 2008 show us some interesting things. This is the data across the U.S. on the number of employers by size. So you think of the FedExes and the Walmarts and the giant conglomerates, mega corporations. There's 18,000 companies with more than 500 employees. That's on the far right. If we come down and look at these employers by size, we see that the small companies, 1 to 9, 10 to 100, 100 or more, we're looking at 99% of the entire U.S. workforce works in companies of 500 employees or less. Now, if we ask ourselves, well, how many of these companies have employee wellness programs? Well, we can look at that data. Most wellness programs are in the larger companies and corporations, the larger work sites, the larger municipalities. Those employers with more than 500, typically more than like 1,000 or 1,500, almost exclusively, almost without exception, they have employee wellness programs. high prevalence with the big companies. When we come down the scale, it goes almost to zero. With small employers, 0 to 9 employees, we're in the single digits in terms of the number of employers who have anything in the wellness area. And there's really no data here. The best data we have occurred back in 1985, where the former American Association of Fitness and Corporate Health Wellness people, they basically did a sample survey. It's 25 years old. We have no data. We do know this. There is nothing happening in the small businesses on a scale that is important. Approximately 6 to 7% of all companies with 500 employees or less have any kind of wellness programming in place. And yet, look at where they're working. This is where people work. 60% of 60 million Americans work in greater than 500. Half of everybody work in large companies. The other half work in small companies, and yet they have essentially no access whatsoever to employee wellness programs. I mentioned opportunities. The opportunities to do wellness in small businesses has never been greater. The data is growing. It's more compelling. The reasons for doing it are there. Now, there are barriers, and we'll talk about those. But if you look forward to the next 1, 5, 10, 15, 20 years, wellness in the large mega corporations is already pretty well established. It's the small and middle market where this is going to continue to explode. And that's half of the entire U.S. population. So there is you want to be a futuristic and look in your crystal ball and see where this profession's going and see what's going on. This is it. This is where this is going in a big way. Not to diminish what's happening in the larger companies and help them do this better. But it's the small and mid-sized companies that are going to lead this. And brokers know this because that's who they work with all day long. So this is a ripe opportunity to do good things, except there's a lot of barriers. There's a floral shop with probably 7 employees. There are factors at play that are going to keep small businesses from doing this that are not issues with the larger companies and the larger businesses. There's economies of scale. There's profit margins. There's having on-site staff and people to help out. There's a variety of reasons. I want to just address each of those really quickly, because if you don't address the barriers, whether you're a wellness provider or a broker or a health wellness professional, if you don't address the barriers, you will have no success in this group. This is what's keeping you out from helping them solve this problem. Barrier number 1, the ROI business. And this is truly an accurate and a fair criticism of this process. The ROI data for all of us in the wellness profession is primarily based on large employers, and there's a reason for that. To get good data on the changes in healthcare costs from wellness, you've got to have large sample sizes. You've got to have, hundreds, thousands, preferably tens of thousands, to really get consistent, reliable data to prove that your wellness program is doing what you think it's doing. Therein lies the problem. With small businesses, we don't have the right number of subjects in these studies. So the ROI data that has been published has been attempted with small businesses, but when it goes to review to scientists or econometricians or statisticians, they don't like the methodologies and they don't like the process because, quite frankly, the results are going to be unreliable, invalid, so they don't get published. There are small companies who do this, but it's very rare. So it's true, the ROI data is stacked by the results of the large employers. They are also almost exclusively self-insured. Small businesses are not. They're part of a pool, which creates another issue. We have a lot of emphasis on doing wellness for employers who are fully insured, who are bearing the full burden of the cost of health care. In terms of premiums, if they're fully insured, they're paying premiums to a broker or to a carrier for which they're getting health care services. Very little of that money comes back to them if they have a healthy population. And there's a reason for that. So let's take just a quick look at this barrier of ROI. Healthcare cost savings for small companies are going to be extremely difficult to get a hold of. for this reason. When you pay money to your insurance carrier as a small employer, you're paying for claims that are being processed by the healthcare providers. You're paying an administrative cost. You're paying that commission to that broker who's putting you together in touch with an insurance carrier. You're also paying the profits for the insurance companies. So up to that point, claims, administrative costs, commissions, profit, those are fixed costs. Those are just money in, money out. There's no wiggle room in there. You're not going to make those costs go down. And then if you do, you're not getting that money back. Where the cost comes from is from the risk and pool charge. In this particular case, they're going to look at the risk of your employee population. They're going to look at age and gender and demographics. And if they have biometric data, they'll take it and they'll make an estimation about how much health care your little group is going to use over the next year or 2 or 3 or 4 and make an estimate. And they're going to pad it in their favor so they don't lose their shirts, even though they do sometimes. And then they're going to charge you what's called a pool charge. And it kind of works like this. Now, this is why small companies have a problem with wellness, because your insurance is really not your insurance. If you look at this chart over here on the left, this is how much a company's experience. This is their claims experience. This is their risk experience. This company of 60 is in this group. If there's only 25 people in this group, only about 10% of this health insurance utilization is used to calculate their premium. That company of 25 is in a pool of a whole bunch of other employers. And 90% of the healthcare cost experience of the pool is used to create that premium. So with 25 employees, you're only picking up this much of your own group. Well, here's what this means. Let's assume you're an employer with 25 employees and you do wellness and you have the healthiest population on the planet. Everybody's exercising and eating properly and there's no stress and their weight's where it should be. And they don't ever use the healthcare system. Well, way to go. You've created a very healthy work site. However, the cost that you're paying for your health insurance, only 10% of that health within your group is being used to make a prediction on your cost. You're still paying at the experience of the pool. This could be all the other people in your insurance pool who may be unhealthy. Your insurance costs are being calculated at this rate, not this rate with 25 people. If you get higher to 90 people, well, now you're going to use 40% of your own pool. In other words, you're going to get more of the benefit of your own employees being healthy instead of this group over here. If you have 250 employees, now 80% of your group's experience is being used. Now, let's just back up a little bit. 80% of your insurance premium for this piece right here, for the pool charge, 80% of 8%. Remember, can't touch this, can't touch this, can't touch this, can't touch this. 80% of this little pool or risk charge you have control. So in other words, you have the ability to manipulate between 2 and 5% of your premiums if you have the healthiest population on the planet when you're small. If you're even bigger up here to the 400 group, then you're about 95% of that pool. And this is about where we draw the line for companies who want to have their own, they want to be self-insured. It's right in this, they'll go as low as 200, but 200 to 400 is kind of the sweet spot where it makes sense to do this. Okay. The benefit from doing wellness is limited to savings in healthcare costs for those that are really self-funded. For the fully insured, which is just about everybody in the small businesses, it is completely unrealistic to expect a wellness vendor or a wellness provider to come in and say, hey, you do wellness and we're going to help you with your healthcare costs, because you're not. Because your employees' health does not impact the cost of what you're paying. Well, if that's the case, why are we doing it in the first place? Well, because there's an enormous number of benefits for doing this outside of the healthcare cost argument. Now, it helps. Again, don't get me wrong. It's 2 to 3 to 4 to 5% of your total premiums can be impacted by this. But there's other reasons to do this. The absenteeism ROI is greater than the ROI for healthcare costs. Let me say that again. When a small company does employee wellness, they will save more money from reduced absenteeism than they will for reduced healthcare costs. You'll have lower workers' comp costs. That makes your premiums for workers' comp go down. short-term, long-term disability are also impacted when you have a healthier workforce. And I think here's the underrated but most important part of all of this, and that is the morale piece. Morale is a big deal. Let me give you an example. One of our clients is a large hotel chain. All of their employees at this big hotel are not insured. There's no health care for the employees of this large chain. They're just there for salary and they get a little pension. No health care. They have the best wellness program because what they have found is when their employees really like working there, when they're treated as human beings and treated well, and they're valued and they're part of an important family, even though they don't have health care benefits, they will remain faithful to that company. They have very low turnover. They have a very caring employer. Morale changes everything. And wellness program sends a direct message to your employees. We care about you. We care about your families. You're part of our family. We want you here for a long time. And that's a powerful message. That's more powerful than anything. And that has direct impact on presenteeism and productivity. It also has direct impact on lower turnover. So let's take just a break and talk about this presenteeism piece for just a second. In next month's issue of the Journal of Occupational Environmental Medicine, we're publishing a paper that I just completed on presenteeism. This used Gallup survey where they surveyed 3 large companies, and we actually looked at data on people who smoke and don't smoke, eat healthy, don't eat healthy, exercise and don't exercise. And we had them do this very aggressive productivity scale or presenteeism scale. In essence, if you don't smoke, you're about 28% less likely to be a high presenteeism. Remember, high presenteeism is I'm at work but I'm not working. High presenteeism is low productivity. People who don't smoke have a much lower risk of being a low productivity person. People who eat healthy are 70, 60, 66% less likely to have low productivity. People who exercise are 50% less likely to have low productivity. So there is a direct correlation between these health risks, and this is based on 23,000 people in this particular study. And we did another one on BMI. And this is high presenteeism. This is people not working much. As body weight goes up, the odds of having high presenteeism go almost up 50% as this number creeps up. And once you reach that obese point, which is 30 or higher, presenteeism kicks in. And there's one more. Neck and back pain, 44% more likely to be high presenteeism. Cancer, 8%. Depression, 60%. Diabetes, 16%. High blood cholesterol, high blood pressure. These data demonstrate that not only do chronic disease and health risks are impacted by wellness programs, but they're impacting in presenteeism. So employers who may not get the benefit from savings from healthcare costs will get savings from improvements in productivity by doing these programs. And that's pretty clear. And this is one of the first big studies on productivity that we've been able to do in the literature for a long time. It'll come out and we'll have a white paper that'll come out. It's the non-scientific mumbo-jumbo version of the manuscript, and we'll make sure we email it out to everybody coming up. I wrote it, and it's a much clearer version than the manuscript. So what's going on here? Who's going to help do wellness? This is another barrier. This is our term of endearment. This is Benefits Betty. We use that term to describe the HR manager, the benefits manager for the small and mid-sized companies. We call her Benefits Betty. She is generally underpaid. She's overworked. She's a manager of many. She has absolutely no experience doing wellness. She's not going to develop wellness programs, and generally, in the small and mid-sized market, she's in charge. This is what we see almost every time with our insurance carriers. The carriers have great wellness programming. They hand it out to companies and say, here's all these great tools. Here, you guys can use them and put it to work. CEO likes it. He goes back to Benefits Betty and says, Betty, your carrier has these great tools. Why don't you get going on that? And she goes, okay, after I get payroll, pensions, new hiring, firing, training, and that lawsuit out of the way, we'll get to it, which means they don't get to it, which means it fails dramatically. This is the single biggest barrier for doing this in small and mid-sized markets. If it's put in the lap of Benefits Betty, occasionally she will learn how wellness programs work and get a certification at WellCoa or something else and do it. But 95% of the time, and we've seen it over and over and over, and the carriers have proven that this method is terrible, it will fail. So what are the options? Benefits Betty is not the one to do this. What are your options? You can go it alone and you can hire her. Maybe there's someone in accounting who does yoga and who's kind of fit and they want to do it. That's maybe better than Benefits Betty, but it's still destined to fail. You can use your carrier-based program, which is, again, we already talked about that. Maybe the brokers, and brokers are aggressively coming into this space. Maybe the brokers are providing wellness solutions for your small business employers. And they're going to provide some services and have Benefits Betty hand them out or do it. Or someone from the brokerage firm will show up and do a biometric screening and then send somebody some results. I see that. I see health fairs. I see these little token brokered efforts to help employers get wellness. Or they can hire a wellness vendor. And there's pros and cons to both. Remember, here's your insurance carriers. Most often they offer nothing for small businesses because you're small businesses. They don't care about you so much as they do the really big, lucrative contracts. Most of what they offer is self-directed, meaning, yeah, we got it, but you got to come to the website and you got to log in and you got to remember your password and you got to do all these things to get in and remember how to do this if you want, and remind yourself. Because they're self-directed, participation rates are horrible. They're terrible. And we've looked at internal data from at least 4 of the largest carriers that I've had access to. We're in the 2 to 5% participation range, whether it's health coaching or online directed materials or whatever it is, and they're all self-directed. We have no published data ever on a single carrier doing these programs for the accounts that they serve. They do programs for their internal employees, and those are some pretty impressive results. But what's brought out to the open market, we have no data that it works. They're fraught with barriers to participation. It's just tough to get in. It's tough to figure out how to manipulate the system. Some of them are clunky, and those barriers make people go away. Here's my beef. The programs from the carriers are only good as long as you're faithful to the carrier. Once you change insurance companies, all of your wellness efforts go poof. They're 100% self-serving. In other words, they're there more as marketing than as they are really helping you solve your employees' problems. Now, that's changing, but to their credit, some of these are free or up to $250. I've seen those before. Here's one that you may not know about. Unfortunately, I think it's only in the state of Ohio. United Healthcare has this program called Zero Trends. Has an employer, and they don't care their size. If you will do things like do high-deductible healthcare plans, high-deductible plans, and have at least 35% of your employees in a high-deductible plan, if you'll get a certain number of your people with good blood pressure and BMIs and tobacco, if you will minimize your ER visits, if you'll use Tier 1 prescriptions and not use the expensive ones, use the generics, and if you'll do biometric screening and offer some kind of risk assessment, you get points, and they total up the points, and this can actually lower your rates from 3 to 14% if you will demonstrate to them that we're doing these kinds of things. So rather than have a carrier provide the wellness services or an insurance company providing the services themselves, they say, look, here's this stuff. If you do this stuff, we will give you a discount because we believe you're headed in the right direction. I think it's a very novel approach. It's not the carrier doing the wellness program, nor is it the broker. They've got to find someone or work with the carrier to find someone to do these, help them with these pieces. But it's a way to actually make a big dent in that pool that they're being charged for. Okay, what are brokers doing? This is where it's really blowing up in the U.S. It's growing dramatically. They've got some in-house specialists, some of them do, some in-house wellness people. They're going to come by and help do a biometric screening, and there may be a health fair or point you in the direction of a health risk appraisal. And this is a big improvement over where they have been in the past. Typically, they would not offer these services. It's not what they do. But brokers are trying to differentiate themselves. They're also trying to help employers solve the healthcare cost problem by improving employee health. It's a good, smart business strategy to have a healthy workforce. They realize that, and they want to help you do that. Whether it makes your healthcare costs go down or not, it's still a good business strategy to help keep and manage a healthy workforce. Unfortunately, small businesses, less than 50, they don't usually get access to these in many cases. Sometimes they do. Again, no evidence that they work. There's no published evidence that they work. And again, it's self-serving. Remember, if you change brokers, everything goes away. And I don't blame them. That's what they do. And some of them are actually getting pretty good at this. You'll have to ask around. The majority are doing nothing. Some of them don't even know what the word wellness means. But there are a few that are actually doing this pretty well. A lot of them, we have found, are just subcontracting the work out. Yeah, we want to help you do wellness. We don't do it, but here's a group that does. Probably 75 to 80% of all the business that WellSteps does is through either a broker or referred by a broker, or a broker will want to do a commission with WellSteps. That's where our business comes from, is most of it comes from brokers. Brokers are dialed into this, but they also know they kind of want to step out of the way and leave it up to the experts. Now, here's an important comment. What about employees of the broker? What about the broker employee, the insurance community? Don't come to my door as a broker and talk to me about my employees and talk to me about wellness programs unless you, Mr. or Mrs. Broker, are doing programs yourself. Don't come here and preach the gospel unless you're going to step up to the pulpit yourself. Because I don't want to hear you talk to me about services that you think are good for me, but obviously they're not good enough for you. So practicing what you preach is a big deal. It's not fair to go to a small and mid-sized business and talk about wellness when you, your own brokerage firm, don't do wellness. So point taken, here's a case study that we published, that Wellcoa published 2 years ago. This is a broker in Portland, Maine, Boston, called Borislow. They got 22 people. Borislow is one of our largest clients, and this is their story. They understand this business of practicing what they're preaching, especially in terms of small businesses, and this is what they do. And they've been exceptionally good at it. They have been at this for longer than any group I know. And for brokers to really step up to the plate and do wellness and to have effective change in their population has been a big deal. Now when they go out and they talk to clients about wellness, they speak from experience. They're credible and they're trusted, and they have huge retention with their current clients because they're really open and upfront with this. Now, here's a case, Sioux Falls, South Dakota, several years ago. Had a broker talk to somebody in their accounting department, who talked to somebody in HR and says, we got to do wellness. This is a great idea. We love it. In fact, there's someone in accounting who wants to help, and she's a triathlete, and she loves to exercise. We're going to have the City of Sioux Falls Triathlon, and we're going to encourage all of the Sioux Falls employees to participate. 6-month training program, jogging, swimming, biking. They printed up a bunch of shirts. They got 300 people who signed up. They got about 27 who started coming to the practice. 6 months later, when the triathlon started, there were 6 people left. 6. And those 6 were triathletes before the program ever even began. So what happened? Well, what happened was a complete wellness failure. Not only did they waste money on about 250 shirts that they never gave away, they had to hand them out, nobody participated, it died on the vine, and they fired their broker and got somebody else who could help them do this thing right. So be warned. There are some other issues here. The HRA, you know, you do a health risk appraisal to get data. We can't get data if you're really small because you don't have big enough pools. There's no aggregate data. So why are you doing a health risk appraisal? Health risk appraisal might help some people change behaviors. But even then, their ability to change behavior is limited. So just know that with small businesses, the health risk appraisal is not this amazing data gathering tool that you might consider it to be. Cost is an issue for some groups. There are some limits to what can be done in small businesses. You can't have an on-site fitness facility at your workplace if you have 53 employees. It's a big mistake. Programs can cost between $100 and $200 per person, a good program. Now, here's where your broker is important. These brokers and producers can come up with really creative ways to get some funding to do this. Our WellSteps Small Business Solution is $7.95 a month. Brokers often pay this cost. Sometimes they'll pass it along. Sometimes they'll fund it into their renewal. Sometimes they'll work with the employer to set up an incentive program where Those that are participating get money back. Those who are not don't. And in essence, some of the non-participants help fund the program for everybody else. So there's lots of creative ways to do this. There's even some ability for brokers to tweak deductibles and copays and premiums to build in a bit of a slice to do wellness with. And that's probably the best way, because then it gets built into your benefit structure. And there's direct benefits for that. There are some grants. I mentioned the state of Ohio, $15,000 per employee per year, per employer. They can do that up to 4 years. It requires biometric screening. But if those of you who are on the phone are from Ohio, the Bureau of Workers' Compensation Wellness Grant starts in July. They got $4 million. We're just there right now. We've got a bazillion people that we're helping with those applications right now. Indiana had something similar, though I haven't heard what's happened, but came through the legislature, and that was a year ago, and I haven't heard a word since. And then there's $2 million that are set apart by the Affordable Care Act with Obamacare, and it's up in the air right now. I understand that if it goes through the courts, it has a possibility of getting funded, but I'm not holding my breath on that one yet. So there are some advantages to the small businesses doing wellness. There's a lot of strong social support. Participation is always higher in small businesses. We're rarely lower than 90% for small businesses. Everybody's there. There's limited benefits. Maybe you don't have health care, maybe you don't have a pension, but wellness has a huge impact on morale. There's this we're family mentality, and they tend to care more about their family. So wellness is a natural fit. And there's something to be said about doing this in a collective, in a group. These tight-knit small businesses are all on this together, and they actually work exceptionally well. There's a great little incubator to do wellness in these small companies. And we've been doing this for years, and we've seen it happen before. So in terms of absenteeism, if you have absenteeism at a small business, it's pretty tough. It can really whack you. That's why it's so important to keep people at work. So the benefits are even greater on the absenteeism side. And for the vendors, wellness vendors, and the brokers out there, this is a really good competitive advantage for you guys to be involved with wellness with small businesses. Now, leadership support is critical. Without it, it's not going anywhere. So what do some of these successful programs look like? What do they do? Well, there's always an assessment. There should be some kind of culture audit, change process to change culture. We want to have a good tracking tool.
Audio, Steve.
Are we back, Brian? Yeah, we lost you for a minute.
We're back. Yeah, we missed that last slide. We missed the whole slide.
We just got leadership. Leadership is a critical piece here, and we want to make sure that leadership is on board. We've had some small businesses brought to us by brokers, and the broker thought it was a great idea, but the business wasn't fully convinced. And unless they're on board and they really want to do this, sometimes they fail. We've had some small businesses come in and they're gone after 1 year because they didn't get the business case. They were never taught about it, and it's the broker's fault for bringing the wrong people to the table to do this sometimes. Well, this is what a good program looks like, and you've seen this before: assessment, culture change and process, good activity and incentive tracking, a tracking tool, good behavior change campaigns that are engaging, that get everybody involved. We always include spouses because that's a critical piece, and then some good evaluation at the end. That dramatically or graphically, it looks like this over a 1 year period where we've got to help them plan it. Remember, Benefits Betty isn't going to do this. We handle the communications, the marketing, we track incentives, we help with the assessment of the culture and the individual. We assess the work site and the individual. Then there's the meat of the whole program, which is the campaigns, monthly activities, and webinars, incentives are engaged, and then a good evaluation at the end. This is what we've been using. Our key, and the trick is this: it's this guide. This WellSteps employee that is the coordinator of every site, whether this is one company at multiple locations or multiple companies. Every site has an on-site coordinator that is an employee, but it is the guide that does all the heavy lifting. It's the guide that actually helps the employees engage and is there doing the day-to-day. It's the guide that does what the Benefits Betty is not going to do. And we've seen it fail with just Benefits Betty over and over. Here's the way it works. You can tweak their behavior, you're going to change their risk. If you can change their risk, you're going to prevent chronic disease, and if you change chronic disease, you're going to save employee expenses. Here's another example of this exact model. Now, this is an engineering firm with 300 employees. We published this paper last year in September in the Journal of Occupational Environmental Medicine. This is 1-year results. The reason I share this with you is because they're located at 24 different locations around the U.S. How do you do wellness for one small company spread out over 24 places in 9 states? It takes the technology and the guide process to deliver this to multiple locations. 84% participation. Now here's what we got. Remember, it's behavior. Smoking's down 40%. This is days of smoking per week. This is for the entire population. This is year 1. It's 12 months. Absenteeism is down about 6%. Not big, but we'll take it. Productivity time is up a little bit, just a little bit, but it didn't go down. And that's good. This is especially this first year was 2008 when the economy was tanking. So I'll take that. I'll take that productivity piece. Emergency room visits down 33%. We've got healthcare visits down 5% year over year. This is year 1. 2-year results, we published another paper, and this is in population health management. It will come out this year. It's in press right now. Look what happened to exercise days per week. Not only did they go up at year 1, but they're still going, which is, I couldn't be happier with these results to get such a big increase and have it keep going. Exercise minutes almost doubles and then persists for 2 full years. We're happy with that. We're happy with fruit servings, almost a half of serving, and it just keeps going up. We've got vegetable servings that continues to go up. These are the kind of results that make me love my job, because I know we've changed behavior, we're changing risk. Now, Kaiser Permanente is doing this with 100 companies. Small businesses they've pooled, and we're tracking that now. We're in year 1.5, year 18 months with this small pilot with Kaiser Permanente. They're doing wellness with WellSteps for 100 small businesses, and now we can pool them together and look at their claims data across time. Now we got just a couple minutes. I want to take a quick break. Whitney, did you by chance get on our audio? Whitney, can you hear me?
Yeah, are you able to hear me?
Whitney,
Yeah, can you hear me?
Are you here? Good. Whitney
Yeah, I'm on.
This is Whitney Richards. He's our National Director of Sales. Nobody knows more about working with small businesses and on-site wellness people and the broker community than Whitney Richards, because this is the group he works with all day. He has these discussions. I've asked Whitney to put together a list of 3 things small businesses can do to get started from his perspective, and 3 things that brokers can do to get started with small businesses. And Whitney, I'm going to turn it over to you, and I've got a slide here showing your first 3 for employers. Let's hear what you have. Hear your perspective.
Okay, very good, and I appreciate that. First and foremost, realize that the thought of getting started for a small business is usually the hardest part. Bringing yourself to look for options to your wellness problems oftentimes seem daunting. However, wellness provides a solution that is really that's really affecting everyone. We're all dealing with increased health risk. We're all dealing with increased costs, and this is really driving all of us. However, the risks aren't going to fix themselves. I oftentimes feel like I'm watching a little kid on a diving board, where it's the first jump and they're up there and it takes forever for them to jump. They just can't seem to get over the fact that this seems impossible and it's going to kill them. However, they make the jump, they love it, and they go back for more with the only regret that they didn't start sooner. So starting a wellness program, especially when it's a comprehensive program where we're doing all the heavy lifting, isn't as difficult as you're going to think it is. So getting started oftentimes is the worst part. Second, know that although you're probably not self-funded, as we discussed, and we know that there's barriers to that, there is still an incredible return on investment that you can expect from the program. Wellness, or excuse me, the rates aside, improving the unhealthy habits of your employees, improving the risk factors, making your employees happier, healthier, more productive, it's going to make them more committed to your company. You're going to see incredible results as that takes place. So know that that is something that a lot of small groups are seeing and appreciate and are continuing their wellness efforts because of that. And then third, simply contact a wellness professional. We're here to help, whether you're using our ROI calculator, or you're looking for information from a library or case studies, medical journals, or just looking for answers to how to better customize your plan or to start a wellness program, you can call us, contact us. There's no obligation. We're always willing to help provide you with the material that you need. So our implementation process is extremely simple. We customize the program to best fit your need. And for employers, the question isn't typically, will wellness help? Rather, it's what needs to be done to make the wellness program work. So as we discuss your goals, as we provide your wellness solutions, and as we work with you to ensure the success of your wellness efforts, then you're going to see great results. Otherwise, we find that most employers a year down the road are asking the same questions on how we're going to help employees, how we're going to lower these costs. And so, just getting started, contacting a wellness professional is going to make the biggest difference. So for employers, that if we can focus on that we're going to overcome those barriers. Now, concerning brokers, first and foremost, know that employers aren't just interested in wellness, but they expect you to be a wellness expert. Many of the brokers we work with are contacting us not because they're motivated by wellness or they're interested in wellness, rather their groups expect them to know about wellness. They've got groups that are asking them questions. They've seen that the wellness trend is changing, that employers are expecting various wellness options, and in order for you to be successful and to maintain that positive relationship with your group, you need to know your stuff on wellness. So whether you're interested in wellness because it's something you're driven by, or you simply got groups that are interested in wellness, contact us. We're happy to provide you with that information and allow you to be seen as that wellness expert that they expect. Second is continue to attend our webinars, visit our site. Most of you on the line today aren't here because you had no better options on a Friday morning, but it's simply because employers have wellness-related questions, and your job is contingent on maintaining that positive relationship with them. So contact us. We're happy to walk you through what well steps we'll offer. Even more so than that, what's crucial for a wellness program to be successful. We'll walk you through a one-on-one webinar. Show you exactly what it takes to get a program started, what the important components are. We'll provide you with material, whether it's printed material or case studies or medical journals, whatever the case. We'll provide you with the material that you need so that it can be a relevant and something that's beneficial for the employers. And then third, just simply asking the right questions will make some of the biggest difference. How many of your groups would love to see their employee-related expenses lowered? How many CEOs would love to see their employees more invested in the company, or healthier, or happier, or more productive? And I'd be willing to venture that almost all of the groups would respond positively to that. However, most brokers don't bring up wellness as that type of option, or that it's simple. Rather, it's simply brought up, and they ask a simple question, would you like to do wellness, which unfortunately raises about a dozen red flags because of some of these barriers that we've discussed today. So the last thing that they're thinking about is improving the health of the culture, because they're focused about all the things that need to be done. So if we can focus on asking the right question, on being sure to focus on the positive results that will result, or the positive results of an effective program, and ask questions about that, well, then you can have the confidence that not only will we do the heavy lifting, but we'll deliver above and beyond what they can expect in the terms of wellness, and regardless of what their solutions need to look like, you're going to be the hero through it all. So as long as you're asking the right questions and asking them in a way, you're going to see success with your groups.
Whitney, I want to ask you to stay on the line while we're going through some of our questions. We might have some directed towards you here at the very end. But thank you for that perspective. And again, Whitney does this all day, every day, and all of our salespeople do. They know more about this aspect of it than I do, because they have the discussions all day long. And we're not going to improve the health of Americans unless we engage these small employers in improving health. The last study I'm going to share with you real quickly, last 30 seconds here, is this 5-group study we've done. We've got 5 small employers which we pooled together. These 5 that we pooled together will come out in another study. It's accepted. It's going to come out in print, where we now have 1 year worth of data where small employers have pooled together to give us enough people to look at results. And I just wanted to show you, this personally is why I and Troy And this is why WellSteps exists, is to change this. And you can interpret this in many ways, but let's say exercise, those who are exercising 3 days or more per week. At baseline, it was 52% of the group. Remember, there's about 300 people in the study, 5 different work sites combined together. At the end of a year, it's at 72%. So what it means is out of 350 people, at first there were 52 of them, 53 of them that are exercising 3 days a week. At a year of, we've now added 20% more, which is 20% of 350 is about 75. There's 75 people out there in these 3 little companies that are now physically active more than they were a year ago. 75 people. There's 75 people who are getting the benefits of exercise more. And in a day, and this is minutes, those are getting at least 90 minutes a week, goes from 47 to 70. Whole grain servings goes up 10%. There's 10% more people getting 5 or more servings this is per day, by the way, not per week. That's a mistake. Vegetable servings. We got 10% more getting the minimum of 2 or 3 in fruit and vegetables. Fruit's up about 30%. Okay, there's 30% more people getting at least the minimum. Restful sleep goes up almost 20 to 30%. To me, one way to look at this data is go, well, they're not all of a sudden these really healthy people, all of them. No, we're still missing some. But we're sitting at a spot where we've now improved the health of 20 to 30% of the entire population. When you multiply that out times our book of business or times a national population, we're looking at hundreds of thousands, if not millions of people who are going to benefit from this because they got the right tools and the right strategies in place. And it is these kinds of results that we publish that make me want to get up every day and get started, because essentially we're transforming lives. We are saving and changing lives by helping people adopt behaviors, healthy behaviors. So here's the summary. These small employers are having a hard time keeping up with the costs, and they can't afford to do nothing. They need help delivering effective programs, and that's where you all on the phone come into this equation. It's you who's going to help them do this. They can't do it themselves. If it's done correctly, they can improve health and the bottom line. And we've got lots of data about them improving the health. And lastly, this thing is the future. Now, all of the slides that I've shared with you today, the 3 points for employers and brokers that Whitney shared, are all posted on our website, as you know. Go to the webinars link at wellsteps.com. Also, next month, Dr. Adams, we're going to do some more work on this topic. We've had so many people wanting to know how to do this. We wanted to go back to basics for 1 month, and we're going to talk about Worksite Wellness 101, how to build an effective program. If brokers or vendors or employers are going to do this on their own, or they want to know how to build this out, here are the pieces that go in to make this puzzle work. With that, Ryan, we're going to open it up to Q&A, and I got myself here and Troy if he wants to pipe in. We've also got Whitney staying on the line.
Okay, Troy will not be with us. He was feeling quite under the weather and has left. Just a few quick things. As Steve mentioned, the slides and recorded webinar will be available on our website. Also, it was brought to our attention by Tambi that the Indiana small business grants are no longer available, sadly. One thing, Steve, I don't know if we have time for this, but slide 37 is when your audio went out, and we had quite a few requests to go over that slide again. I know it was kind of an important one, the advantages of doing wellness in small businesses. I don't know if we could just quickly run through that one at 1 minute synopsis maybe.
Well, there it is. That's slide 37.
Yeah, I guess people can read it.
Yeah, and all it really says basically is that small businesses, despite the barriers, have advantages for this. Strong social support to do this together. The participation is always really high in small businesses. And even though there's limited benefits, maybe they don't have health care, wellness programs are great for morale. There's a very strong tendency towards family in smaller businesses. They're family owners, business owners. And the benefits associated with wellness are big for small business in terms of absenteeism. If one critical person at a small business is gone, it has a huge impact. So absenteeism is more vital to prevent at work sites that are small. And then there's a competitive advantage for people trying to promote and do wellness with small businesses because of the opportunity.
Okay, yeah, thank you for going back over that. One question that's kind of come up a lot is just basically, you know, in a group that has a limited budget, you know, we have a self-confessed Benefits Betty on the line who asked a question. You know, she's got a group spread out over several states, and they don't have a lot of money to spend. What is the best approach for them? You know, she wants to know if working through a vendor, a broker, or working on it by herself, if she has the time, would be the best approach.
5, 6, 7 years ago, I would have said, no, you have to start on your own and try to do something with these groups, but they're spread out. Today, we have the technology available to not only deliver materials and technologies to each of those groups regardless of where they're at, but to have a central access point that is extremely easy and convenient to use. EI, we can use the web or text messaging. We can use the technology to communicate with that group, which we couldn't have done 5 or 10 years ago. So find a vendor that's going to help you contact and work with every one of those groups using the technology. And I don't anticipate anybody's going to develop this themselves unless they're a wellness vendor, because the cost is just, it's not possible to do. It's taken Troy and I 6 years to get to where we're at now. But our systems are being used in Australia. So talk about being able to reach around the globe. We deliver behavior change programs in Australia. And it's the same technology. Now, we do have physical materials and things we use. We have people on the ground, and guides go there and do some of that face-to-face work. But it takes a way to communicate effective tools and strategies to all of them. And the only way I know to do that now is to use someone who's got the technology in place to effectively reach all of them, including spouses.
Okay. One other question was kind of how to measure productivity and presenteeism. They wanted to know specifically on those studies that you mentioned, and then also, you know, how they can track that over time in a small business setting.
Yeah, you just want to send me an email, steve@wellsteps.com, steve@wellsteps.com. I will send you the manuscript for their paper that's in press. And the actual tool that is used is in there. It's a combination of productivity measures from the Harvard School of Public Health that's been used over there. It's been validated. It's pretty simple to use, and I can even send you those. It's what's used in the Wellbeing Index from Gallup, and I'd be glad to mail that out. steve@wellsteps.com, and I'll just fire it off to you. It'll show up in the literature here in about 3 weeks.
Great. Now, we had questions about how to reach, you know, we've talked somewhat about online solutions. How would you reach a group that does not, you know, have computer access or internet access?
There's 2 ways. Everybody has a cell phone, and though it's not the best, we can do some text messaging, and we have built-in text messaging to our services. Every campaign that we also offer is available paper and pencil, which means we physically mail it out to the on-site coordinators who then hand it out. They complete it, they drop it in an envelope, they mail it back, they're a participant. They have to do the same tasks, the same tools, they get the same strategies as everybody else. They may not get some of the video, but they'll get the same materials. They'll sit the same guides. And most of it now is available in Spanish also. There's a lot of our Spanish employees who are looking for non-web-based programming in Spanish. So we're back to the traditional format with paper, pencil, and now texting to reach this group. We forget the web.
Great. Okay. One clarification. Borislow, while they are one of our greatest and favorite clients, they're not necessarily one of our biggest, as I think you may have said during the...
They're big in heart. That's what I meant to say.
Exactly. Yes. Now,
and that's Karen Kelly, by the way, at Borislow. Hi, Karen. She's she's a pioneer in this field, and we love her.
We did have someone who wanted us to point out, and I think you did this, but you know, keep in mind some brokers are doing a great job of wellness and are proud providers with very happy clients with successful programs, and I think that we would definitely agree with that. don't know if you have anything to add to that, Steve.
No, I agree. You just got to be careful, though. Shop around. Maybe go to the brokers that are doing this well. I'm all for supporting the brokers who really believe in this and do it well.
Simple question. What is our definition of small business? Somebody was curious.
Same definition the government uses. In this particular case, it's 500 employees or less. But the opportunities for less than 25 are 100-fold bigger. So small businesses, us, is from 1 to 500, and we service them all, and the brokers service them all.
Okay. And then just kind of to end, for a group that has, a limited budget, do you have any recommendations on, how much of a budget they should put per employee, or if they have a limited budget, what areas should they focus on related to wellness?
Well, if they've got some more money, coaching is one that a lot of people are drawn to. It is the most expensive of the bunch. It doesn't have the kind of reach we'd like it to have. We want it to reach everybody. I would encourage them to go towards some vendor somewhere that's going to give them a population-based. It's going to touch everyone and their spouses, because that's who's impacting your bottom line, is every single employee, not just the 2 or 3 who reach out to a coach. All of them, and spouses that are there. Typically, $795, $895 per employee per month are some cost ranges. That's about the lowest one I've seen. That's where we're at, and they go up from there depending on the services that are provided. I'm a big believer in the behavior change piece. Do something that helps them change behaviors. Health risk appraisal and biometric screening is good, but other things are better in my mind. We can talk more about that offline, or they can call and talk to our salespeople who answer those questions specifically for each site.
Okay, I think that's all the questions we have here.
Thank you, Ryan.
We do have more, but
Ryan, Troy, Whit, thanks for all the help. Everybody, keep up the good work. Remember, the slides are available at wellsteps.com on the webinars link. Please use them, download them. Feel free to rip them off completely. Put your name on them. I don't really care. And we will see you in a month. Thank you.